Hey Keith, it's Donnie. We're just getting started on the right knee. We're looking in the medial compartment. This is where the medial meniscus is, and the anterior horn looks pretty good up here in the front. As we look towards the posterior horn, we're going to get a good idea of whether or not it's torn. Let me see a probe, please. And so we'll put a probe in here. You can see some of the wear and tear changes in the cartilage down below. This is in the tibial plateau here, some of these little crevices. Hold it. But then as we look at the, you can see some loose pieces of cartilage floating around. We'll get those out too. But right now we're focused on this posterior horn of the meniscus. And so far this is checking out okay. Can't really demonstrate a tear. So we're going to flush out some of the loose pieces. We'll go off on the video for a minute. Pause. Okay, now we're looking in the central part of the knee. This is where the big ligaments are. Your ACL is this strong looking thing over here. PCL is going to be back behind here on the right. So running up in this fashion, that's actually your ACL with some soft tissue in front of it that we've been debriding so we can see a little bit better. But your ACL looks just fine, nice and strong. We can see kind of the anterior portion of the medial femoral condyle here looks pretty good. And then one of the other things we notice is there's been quite a few loose pieces kind of stuck up in the anterior compartment. And we've been working on those also, just removing a lot of loose pieces. Now we can see a lot better because I think we've debrided a lot of that. So we're going to go ahead and look in the lateral compartment next. Pause, please. Okay, now as we look in this lateral compartment, we can see there's quite a few loose pieces floating around. They're coming to our shaver because we have suction going. You can see as we look down at the tibial plateau here, you can see a little divot in the middle of the plateau, as well as some fraying and softening of the cartilage up above. But here's a little divot. There's really nothing loose right here anymore. But this is certainly something that we can try and smooth out for you, and hopefully it won't bother you too much in the future. But this is what arthritis starts to look like when people develop arthritis in their knees. So that part of it kind of makes sense. Now, push down hard. As we look towards the posterior horn of this meniscus, it actually looks pretty good, and that's encouraging. We won't have to really take any significant amount of meniscus from the lateral meniscus. Won't have to debride much of it. It's really just this cartilage in the plateau that's the issue. And I think by removing a lot of the loose pieces, that'll help you feel better. There's a little bit of fraying on the inner edge here. You can see this. This isn't too bad though, and is pretty easily treated just with our shaver here and a little bit of suction. Okay, so we will go ahead and look up at the patellofemoral joint in just a minute here. We'll go off on the video for the moment. So here as we look at the patellofemoral joint, we can see that this is another source of loose pieces of cartilage in the knee. We can see these areas that are loose are just kind of hanging down. And look at the patella here. You can see some cracking and fissuring of this cartilage, which can certainly lead to pain and discomfort going up and down stairs or first thing in the morning, or anything where you got to really bend your knee, or where your knee's still for a long time. Like in a long car ride or even sitting in the movies, it may be stiff at the beginning when you first start to move after that because of this area here. And so what we're doing now is doing our best to try and debride this area so that any of these pieces that are about to be loose will be removed today, which will hopefully buy you a lot of time. So I think that's the main story here, is that you've got this chondromalacia and these early arthritic changes in the knee. Okay, so we'll keep working here. I think this is going to be it, though, Keith. I don't think there's going to be anything else really exciting to show you on the video. It looks like we've got most of the loose pieces already removed. So we will get you back to the recovery room shortly, okay? Hope this does the trick for you now. Bye-bye.